Hi guys, hello and welcome to my channel. If this is your first time here, thank you so much for tuning in. Be returning subscriber, thank you very much. But let's coming back. My name is Adekunle Alunduapo. I film about health. Multi-pause. I don't know this kind of introduction, but I'm not going to cut this part. I'm going to put it like this. So actually last week I know I was a video, and because of that I'm very sorry. I had should I call it video malfunction or what? I had issues with the video, got deleted, got corrupted at a point, so there was no way I could post, and I traveled, so I guess so. And I know I actually promised us that my next vlog was going to be about my academics, but I don't know, probably it's not a time to start posting about that. But sure, I'm going to actually post about that. But this today, I actually went to Beat FM here in Ibadan, and I spoke about postpartum depression, and that's what we'll be saying now. Like my talk with the woman, with the host on the show, we expressly spoke about postpartum depression and everything like that, and that's what you'll be seeing. Please do well to watch to the end. Also put your comments. You can also teach people and everything in the comment section. So see you at the end of the after watching. Bye.
Child or to parent the child, and of course we don't only talk about children, we also talk about the parents themselves, and that's why today we're talking about postpartum depression and postpartum care for women. Welcome to the show, and today I've got a guest with me. Her name is Adekunle. Miss Anu, you're welcome to the show.
Thank you very much. Good morning.
Good morning. Anu is a psychology graduate from the University of Ibadan, and she's also an entrepreneur, and she's also a mental health advocate. So on the show today, we're talking about postpartum depression. I know that it's a very, very dear topic, and research shows that 1 in 3 to 5 women in developing countries have experienced postpartum depression, and some go through this mostly. Yes, postpartum depression is mostly after pregnancy.
Postpartum depression is after pregnancy.
Okay, so Miss Anna, over to you.
Good morning, everybody, once again, and also we're talking about postpartum depression. Postpartum depression is, to make it simple, is emotional, physical, and behavioral changes that happen to women after they give birth. That is basically what postpartum depression means. It means the changes, how women handle the changes that occur to them after they give birth. And most of the time, because during pregnancy there are hormonal changes, everything changes. So immediately they give birth, most of the time after 2-3 days, a week max, the body tries to adjust and come back to the normal hormone, which is normal, which should happen because there is no baby in there again. So the body should actually come back to the normal position. And it's, according to DSM-5, it's been proven that because of this sharp change in the hormone, and actually because there is physical change also, like the body changes, everything about them has changed. There is, for some people, they are bigger in size, the tummy change and everything, and then they have a whole human being to take care of. And the fact that there are also changes, like things that they find pleasure in, they no longer find pleasure in them. And then the fact that some people might not be sexually as active as they were before. All this contribute to postpartum depression.
Okay. I know that before now, until recently, there's been limited discussion around the psychological effects of pregnancy and childbirth on the mental health of women. And many times when women go through postpartum depression, society or people around such new mothers don't understand what is going on, and they don't get to like get what is going on with me and just feel like, oh, you're just extra. And she was my cocoa you know, that kind of thing. And that's what it means to be
A mother.
a mother and all of that. So can you just speak on that a little?
Talking about the environmental factors now, I think we have a lot of work to do as a community as a whole, because in this part of the world, Nigeria to be precise,
Mm.
we kind of put less value on people's mental health. We kind of see it as, when people talk about mental health, we're like, okay, this person is extra. This person is giving too much value to what should not give. That's why people don't want to see therapists. When you tell them to see a therapist, they feel like there is nothing wrong with me. Like they only believe that it's people that have mental health issues, like people that are already exhibiting it physically, that needs to see a therapist, which is not so. So as a community, we have to know that this individual that is pregnant now, although she's looking like she's very fine, she's going through a lot. It is normal that as the body changes, there will be some, because there was a time, I've never been pregnant, but there was a time that I was particular about, I want to lose weight. It wasn't like I'm big, but I was just like, I want to lose weight. So now imagine someone like me with the mentality that I don't want to be bigger than this, now getting pregnant
And you blow up inside.
and blowing up in size, and everything is not fitting and stuff like that. And then in the environment, everybody wants to say something. Everybody has an advice to give. Why is your leg big? Why is your hand like this? You are not sleeping well, you are not doing this well. So I feel like the best thing we can do is to support these people. And also, if you are pregnant, don't try to like hide your emotions. That's one mistake people do. When people offend them, they try to like bottle it in, and then after bottling it for a while, it begins to pile up, and then at a point they can't take it again. Don't bottle it in. Try to like tell the person thank you. You can't take advice from everybody, it is not possible. So when somebody says your leg is this and this, just tell them thank you ma, I've found solution to it. And then
Basically, what you're saying is that for pregnant women or people that have new moms and all of that, like it's expected that you have a barrage of people advising you and giving you, telling you do this, telling you do that. But decide within yourself that okay, this is what I want to take. This is how I'm going to deal with it. It comes with it. You're also saying that we, that society, that we should try as much as possible to be understanding
Yes.
of what pregnant women and new moms are
Going
going through,
through.
and not be quick to give advice, unsolicited
Advice.
More.
I feel like we should even ask questions. How do you feel? I noticed that most mom, I spoke with one of my friends that gave birth of recent, and then she was like, she's angry because people would not ask how are you. They won't ask her how she is. They ask of the baby, how is my baby, how is this and that, and she feels like this is like she's been treated.
Oh, she's not seen. She feels like
She's not seen. Exactly, like she's not seen. Like people just feel like, okay, the baby is crying, take care of her. The baby is this, take care of this. Nobody's asking how are you healing up and things like that. So instead of us focusing on the baby, of course we'll focus on the baby because the baby is also trying to adapt, but we have to like make sure that the person that brings forth this baby too is being taken care of. The attention is given to the person too. How do you feel? And before we give advice, let us ask the person, what do you want about this? Don't just impose your own opinion on the person. And as a new mom, instead of taking advice from everybody, just go to your doctor. Ask your doctor, this is what I noticed, these are the changes that I noticed, how can I do this? And then probably your mom or your mother-in-law or people that you know they are experienced and can help you out.
Okay. I also have another question that for making new mothers, how do you like? What are some symptoms to show that okay, like these are signs of postpartum depression, and I need to speak to a professional. What signs, what symptoms do you begin to like exhibit to know that okay, this is time for me to speak to a professional?
Okay, first, crying for no reason. The second one that is very common is anxiety. Like just be anxious that okay, something is wrong with the baby, even when it's obvious that nothing is wrong with the baby, or probably something is wrong with herself. Like she's just being paranoid
When you say
over
paranoid, what do you mean?
being scared,
For no
being
reason.
anxious for no reason, just like something might go wrong, and is being excessive, waking up, not sleeping properly.
Okay.
Even
Not
though
sleeping properly, being anxious overtly, just
crying
scared,
for
crying for
no
no reason.
reason,
You're scared. You're thinking. You're hearing the baby cry for no reason, and it's not like the baby's crying. Really. Okay, so
exactly.
these are some symptoms to show that okay, it is time for you to speak to a professional.
And if not properly taken care of, some people might start to harm themselves and even the baby at a point. So some people would start starving because they feel like if they eat too much, they might not heal properly. Like just imaginations that are not true. And then some of them would come up with things like, okay, they should not feed the baby with breast milk, or they should not even give the baby formula. Somebody that is not expressing breast milk yet might feel like they should not give the baby formula, which might actually harm the baby, and they will start starving themselves and the baby.
So you're saying that for cases like this, that it's advised that when you begin to feel overly anxious, you're crying for no reason, you are scared, or you don't really even understand what is going on or what is happening with you, it is advised that you speak to a professional that will get you the right things that you need to do. I also have another question for people that are like the loved ones, maybe the husband or maybe the siblings of the new mom that are staying with the new mother, and they begin to notice these things. Like, what do you think? Like how can they offer help to this new mom?
Okay. Although first I have to establish that before a woman can be diagnosed of postpartum depression, it has to have occurred more than 4 weeks after birth. So for a woman that has given birth and is experiencing some of these symptoms under 4 weeks, we can still say that it is normal, and then we actually want to monitor the person. But once it's going beyond 4 weeks and there is no sign of improvement, then the person needs to see a specialist that can help the person, not even necessarily a psychologist. Now you can actually go back to see your doctor, who would provide you with so much support until the doctor now sees that okay, it is not going the right way. Then the doctor can refer you to the right person. And then for the family, for the husband, the siblings and the parents, we should make sure that we are very, very supportive. We should ask questions and not just jump into conclusion. Not that when the person is feeling like okay, my body is this, my body is that, please don't touch me, don't do this, and then we are also getting cranky with the person. No, we have to be
Can
very.
You like give some examples of how people like caregivers don't understand what the new mom is going through in a postpartum state, depression state. Like okay, maybe for example, like okay, this thought only comes to me in Yoruba, Kera, that kind of thing. Like, what other ways do caregivers do this, and they're not conscious that they are harming the new mother that they're helping?
The fact that they feel like it's already a week after you've given birth, so please, you can bathe the baby now. Even though she's scared that okay, this baby might fall, and there are some of the imaginations that just come because of the too much care, because of the hormones and everything that are happening. Like, okay, this baby might fall off and everything. So instead of saying you can do it now, you should be able to cook now, you should be able to stand up, you should not walk this way anymore, you should be able to stand up by yourself upright. We should be supportive, asking questions like, okay, what else do you feel you need? How can I help you? And then we should know that it is just for a while. It's not like she would tell you that permanently for the rest of your life I'll be dependent on you. We should know that for the meantime, till she says she's okay, she can do it herself, we should try our best to be her support, and then we should ask questions instead of just assuming that, okay, this person does this. We should know that there are individual differences. The fact that you as a mother, as quick as the second day you were able to stand up and start doing it, does not mean that ours might not take up to like 3 weeks. So we should understand that fact. And the fact that your friend's wife, you got to their place 3 days after she gave birth and she's already okay, does not mean your wife would be able to do the same thing. So you should understand that there are individual differences, and then you should be accommodating. You should try to communicate with them. And then as a new mom, please try to express yourself. Expressing yourself helps a lot. Try to express yourself. This is how I feel. Don't hide it. When they ask you why are you crying, I really don't know why I'm crying. There is no crime in telling people how you feel.
Wow, that's it. That's a whole new one. As a new mom, don't be afraid to express your opinion. Don't be afraid to say that this is what is going on with me. Seek help. Look for try and communicate with your husband. But if a new mom is in a situation where she feels like her spouse is not getting her, and her spouse feels like she's pretending, or her spouse feels like she's too extra and she's not being motherly, what do you think such a person can do?
Like I said earlier, then you can see your doctor to talk to the doctor, because I'm sure that if you actually go to a place where there is enough medical care, it will be both the husband and the wife that would have gone. So you can, and I am very sure that there is no professional that will tell you shut up when you are trying to express yourself to him or her. So such individual will be able to guide you. Like, just don't be tired of going to your doctor. Don't be tired of expressing how you feel to somebody. Trying to bottle it in is the problem. Once you cannot find somebody to talk to, you are building up a problem that you might not be able to solve.
So,
So if the husband is not getting you, or the parents are not getting you, or it looks like you are being extra, because the more they keep telling you, the more you keep piling it up in the head, and you feel like probably it's true, probably I'm being extra, probably this is not how it happens, and stuff like that. So instead of just accepting it like that, try to call your doctor. Doctor, this is what I'm facing, this is it, how can I go about it? And then with time, if the doctor now feels that you actually need a therapist, the doctor would refer you to somebody that can help.
Then you can start therapy and all of that. So I hope new moms and new dads are listening, that a woman is not being extra when she says some of these things, that she might just need to be like well taken care of and all of that. But like from earlier you said that it's until maybe after 4 weeks, post birth,
yes,
that's when you can begin to think that this person is going through postpartum depression.
That's when we can diagnose.
Okay, that this person is going through postpartum depression. But what about cases where the child is like 8 months, 5 months, 6 months, and it seems as if this person is still feeling all these symptoms that you mentioned earlier, symptoms of just not sleeping, anxious, worried, scared, crying for no reason, and the baby is not young. Do you have cases like that too sometimes?
Yeah, we have cases like that, and for cases like that, it is better you get a therapist. That is the best thing before it finally gets out of hand, before it finally becomes something that the person would start to really harm herself and the baby. Because depression is not something that is taken with levity. It's not something that you just overlook. So once it's becoming too long, once it's becoming unnecessarily too long, like I mean, a 8 month baby should by now or standing up by his or herself and trying to do. So if a mother is still paranoid at that stage, where a working mother should be back at work with an 8 month baby. So if you are still paranoid at that time and you still feel like okay, this you are still anxious, you still don't want to communicate with people, you just want to be alone, you just cry for no reason, and then it still looks like you are still not comfortable with your body, you are still not sexually attracted, you still don't find pleasure in things you are doing before the baby came, it is better to seek professional advice.
Wow. Thank you so much, Anu. Like I always say, it's a conversation between you, me, and my guest. And so if you have a question for Anu, the number to call is 0700 1979. I'll call the number again, 0700 1979. 0700 1979. And you can also send us a message on our WhatsApp number and just join this conversation about postpartum depression and postpartum care. I like the fact that you've spoken about some of the symptoms that will indicate that a woman is going through postpartum depression and the role of the people around her. But you know, in some cases, some women don't have people around them except their husband, and their husbands are, you know, they are working husbands, and so they really can't give like the adequate care, because you know, after a while everybody goes back and it's just the lady, and you know, sometimes it's just really overwhelming. It's really overwhelming, and there's nobody to help. Okay, so we have a call. Let me just pick this so that the person can contribute. Hello, good morning. Can you reduce the volume of your radio set? Okay, so we've lost that number. The number to call again is 0700 1979. 0700 1979 to send in your contributions, and if you have questions for Arno concerning postpartum depression. So you know, we've been talking a lot about postpartum depression. Right now, I want you to give us some tips on ways that they can care for a woman that is maybe already going through therapy, or has not even gotten to the stage of going through therapy, and you know, they can just help to make her feel better.
First, she has to know for herself. She has to know for herself that she has to take care of herself. Because at a point, we all have threshold of how we can manage ourselves. So at a point, everybody would almost feel tired. So she has to know that at a point, I have to take care of myself. And so, as I said earlier, communication is very important.
I like how you mentioned that, and you keep hammering on. You have to speak up. You
exactly.
don't have to bottle things up to yourself. Yes.
It is not possible that you would not have one person that will truly understand you, that you can communicate with, even if the person does not live with you.
Good.
Even if the person is not your husband or your sibling, you would have one person that can feel your pain, that actually understands how you feel. So you have to tell the person, okay, this is how I feel. And for people around them, try to make things more easy for them. Try to make things easier for them. Try to help them do stuff. Try to help them take care of them. There are some people that they get paranoid to the extent that, okay, when a place is dirty, it can be as little as the fact that the whole house is dirty, that can actually make some people cry. And then when you ask her, really, she feels like
new moms and new dads should watch out for something that might be a
trigger
for the woman,
exactly.
Try to help.
Try to sit down, and then there is no, as much as we say, okay, she cries for no reason, the no reason might be something unreasonable in quotes
to us,
but to her it's actually means something. So it might just be like because the house is actually dirty, that was why she just felt like, okay, if she's not in this position it wouldn't have been dirty, and then that's why she's crying. So try to like watch out for what actually triggers why she cries, why she's paranoid, and then try to make sure that she rests. As much as people do say it is impossible for you to rest when you have a newborn because of breastfeeding and stuff, you have to like try to find out, try to create time for you to rest, because it is needed in everybody.
Thank you so much. I know, as in, it's been a lot, and we've learned a whole lot of things. And so, any new mom or new dad, or if you're a caregiver that you have a new mom or dad with you that is going through, because many times we feel like depression is only on the woman, but more often than not, you have people say, the man too is going through quite a number of things. And the truth of the matter is that pregnancy, childbirth, delivery, there's a lot of changes that is going on through a mother's body and all of that. And like Anu has explained from a psychological point of view earlier, that these things can cause different changes in woman's body, that we should try as much as possible to be loving and try to be understanding. And in cases where it seems like it's getting out of control, recommend such people for professional care, and they should seek professional advice. I'll talk to their doctors. Thank you so much, Anu, for everything. I think we have a call before we leave. Let's see if we can take a call quickly. Hello, good morning. Good morning. Your name and where you're calling us from? Okay, love it. Would you like to contribute quickly? Okay. Okay. Okay, love it. Can you speak up a little bit? We can barely hear you. You're speaking about a new mother that her stomach is paining. I don't think we heard that. Did you?
I did not.
Hello? Hello, love it. Okay, can you say what she said all over again? Okay. So okay. All right. So Annie, did you get that? So she was asking. Thank you, Lovett, for calling us. She was asking that after the new mother gives birth, she's feeling pains in her stomach, and she wants to know what is causing that.
She should actually see a doctor for that,
Okay.
because that's the right thing to do. Don't seek help from somebody outside. Go back to the hospital where you gave birth and let them know how you feel.
All right. Thank you so much. So, lovers, I hope you're listening for that person that you said that knows that's always feeling pains in her stomach after giving birth. The person should go back to the hospital. The person should go and see a doctor and talk to the doctor that, okay, I still feel pains in my tummy, and I want to know what is going on with me. Thank you so much, Anu. This has been a like very, very enlightening episode. Join us again, same time, same station, on Parenting Conversations with Dami Fad. Anu, how can are you on social media?
Yes, I am.
Okay, so tell us your social media handle.
So on Facebook, Twitter, and Instagram, I am the Anu Adekunle, double ANU actually.
So D is
CHA Anu Adekunle.
Alright, thank you so much, Anu. We appreciate you for coming on the show.
Thank you for having me.
Alright, guys, that's it for today.